Hi everyone, welcome to your Meet Your Doctors videos. We have come together as the Doctors of Grow Health to do these videos to respond to the very common and very understandable concern of what? I might not get to meet the doctor who delivers my baby before I deliver. Super common, very normal response, and we totally get it. But of course, your doctor can't be on call at the hospital 24 hours a day, 7 days a week, and nor would you want that sleep deprived doctor delivering your precious child. So we take turns. But we are going to show you in this video, hopefully, we're going to reassure you that we're all pretty darn similar. If you like one of us, you will likely like all of us. And in fact, what I say to my patients is you will likely like the doctor who delivers your baby better than me, but please don't tell me that. So here we go. What we decided to do is introduce ourselves and tell you a bit about our birth stories, and then give a little Coles Notes Pearl tip about labor and delivery, which directs you to some of the other videos our excellent colleagues have made. And hopefully this gets a little picture of ourselves shown to you. A very wise nurse on labor and delivery tells us that every woman will remember her every birth. And it's a story that they will tell over and over. And it is really a unique and special way that women bond together. So we're going to tell you ours, and we really care about yours, and we can't wait to be on this journey with you. So here we go. I'm going to go first. I am Dr. Jen Cranmer. I am one of the co-founders of Grow Health and the co-medical director. I myself have two girls, and they've been different right from the start. My eldest is about to go through puberty, so wish me luck. And she entered the world slowly, and she continues to do things very meticulously. My delivery with her was about 24 hours long. I should say my labor with her was 24 hours long. It started out in Blockbuster. Yes, Blockbuster. That happened with, I think, a Dairy Queen Blizzard. I labored all night. I felt pretty cocky. Figured, I'd rock into labor and delivery about 5 centimeters. Went in early in the morning. Nope, I was a centimeter dilated. They sent me home. I was working there at this time, so everyone knew me, and that was pretty humbling. A few hours later, I went back thinking, oh yeah, I'm definitely more dilated. Nope, I don't think I was any more dilated, but I think they told me I was more dilated and then kept me there for the course of the day to help me along. And the day went, there was morphine, there was epidural, and after a long day, my first was delivered, and it was great. I wouldn't trade it for the world at all. My second, entirely different. She came out like a rocket, and she continues to be super feisty to this day. I swore like a sailor in that labor and delivery room in front of all my colleagues. And some of them heard me down the hallway wondering who the heck was that crazy woman in there. And it was the previously quiet Dr. Cranmer screaming like a sailor. My poor husband probably was traumatized. I arrived 3 centimeters. I think the nurse left the room to have shift change and report to the next nurse taking over. And during that brief moment when she left the room, I think I slapped my husband and said the baby was coming. And indeed she was. So that one had no pain relief and was super overwhelming. And I think probably, even though it was super short, harder than my first. I wouldn't trade either of them for the world. Love being able to tell their story, and I do often tell their stories often. And what I always remember about those deliveries, I love my family doctor. She's an absolute gem. I think she actually might be Mother Teresa, but I remember the nurses in those deliveries. They help us so much, and they are such wonderful and skilled creatures, and it is definitely the best part of my job that I still get to see them all every day, the ones who help me with my deliveries and who will help me with yours. And in truth, we know that you all are going to be okay not meeting us all in person, because it's the nurses who are going to get you through this, and they will become your best friends and you will remember them forever, like you will remember your birth. So enjoy hearing from the other ladies. Maybe I'll get to see you in your delivery, and enjoy this wonderful time. Take care.
Hi, I'm Dr. Ioana Smirnov. Thank you for the privilege of having the GROW team look after you for your pregnancy and delivery and postpartum care. We are very excited to walk with you on this really special journey in your life. I have 2 children. I have a 5-year-old boy and a 2-year-old girl, and probably what I can speak to from personal experience as well as professional is our team-based approach. The GROW team has looked after me for both my pregnancies and deliveries. Dr. Jennifer Cranmer is my family doctor. Dr. Alicia Power delivered my son. One of our lovely locums, Dr. Jenny Condra, delivered my daughter. On top of that, my first labor took quite a while, as they often do, so a few of my other colleagues were also involved at that point. And I can truly say from that experience myself, as well as working alongside all these wonderful doctors, that we really do all approach maternity care and this journey in the same way. We have the same philosophy of care. I understand that it can be nerve-wracking to possibly not have your physician that you have grown to know over many months there for the actual delivery. I can hands down say that whoever is there for that really special day or days, depending how it goes, will be just as passionate, will communicate just as clearly, will be just as caring, and you will be in really good hands. Obviously, all of us have our ideal version of a birth journey that we hope for. However, as the other videos can attest to, deliveries can have some detours and some bumps in the road, and we will go through that with you with the same approach, regardless of which one of us it is. So I look forward to meeting you, possibly on the labor and delivery ward or at the office. Thank you again for choosing us, and good luck and enjoy this really special time in your life.
Hi, my name is Dr. Harmon. I am coming to you from my garden because this is where you go to hide and get things done when you have 3 young children. I am one of the original members of the GROW Health team, so I've been there for about 5.5 years now. I have 3 kids, Cameron, who's 4, Julia, who's 6, and Summer, who is 2. 2 girls and a boy. So I remember pretty freshly what it's like to be pregnant and to go through labor and delivery and the recovery postpartum. One thing that I can tell you is that it was about the 3 best days of my life, having the 3 kids. I'm not sure what that says. Either I had good deliveries or my life isn't that great. But anyways, I thought it was a really special experience, and I'm looking forward to going through that with you too, both if I follow you in your pregnancy and if you end up being with me on the day that you deliver. I feel like my role with these videos to get you guys to know us is to make sure that nobody is afraid of being induced by the end of this video. I have 3 babies and I have been induced 3 times. I come from a long line of over-gestators. I was actually 3 weeks late for my poor mom. I was her first baby. Her next one, she was 2 weeks late, and the last one, she was about a week and a half late. So as far as induction goes, I think a lot of people are worried about that and fearful and hope that they won't need to be induced, but you know, I thought it was great. I tried all the things to get myself into labor. I tried the teas, the hikes, the stuff you don't want to hear me trying about, acupuncture, membrane sweeps, you name it. I tried all the things. Never could get into labor. But you know what did work? Oxytocin. My cervix was always ripe, so I didn't end up doing any of the cervical ripening things, but I would encourage you to check out our videos that we have on our website about augmentation and induction of labor. We'll go through all the methods. For my labors, I started right out with oxytocin. The first baby that I had, she took about most of the day to come. It was about 8 hours, I think, from start to finish. And it just started very nice and gradually with the oxytocin. We started a low dose so you don't get slammed into labor. I think that's what a lot of people fear. I haven't done it without being induced, but it looked a lot like what I see other people go through. when they're just going through it naturally. And it was great. And how I sum up all of my deliveries when I do the labor and delivery talks is that it hurt off and on for a few hours, and then a baby came out. And with her, it was a great labor. I really liked the nitrous gas. I think I used about a 10-person portion of it, and that got me right through to fully dilated, and I pushed for about an hour or so, and then Julia was born. And she was a very nice delivery and recovery. And then with my other two, they were a bit more surprising to me. My second one I thought would kind of go similar to the first. I was also induced, got oxytocin, and after about a couple of hours, my doctor walked into the room. I don't know if the nurse had called her because I looked like in a bit of a state or something, but she came in and she looked at me sitting on the exercise ball, which I highly recommend as a place to labor, and said, "Oh, you look like you're working." I said, "No, I'm fine. Sucked on some more gas. And then she said, "Oh, are you pushing?" I said, "No, I'm not pushing." And she said, "Get on the bed and get your undies off." And I did. And 10 minutes later, he was born. And so that 10 minutes hurt a bit. And it was a bit surprising. And so I was pretty thankful that I actually wasn't at home for that labor starting, because I think if I had been, I'd have probably had him at home or on the way, and my poor squeamish, gaggy, nauseated husband would have physically died if he had to deliver the baby. So I was grateful to be induced that time too. And then my third, by that time came around, I thought, boy, I better come in here and sneeze and have this one fall out. And it wasn't too far off that. It was pretty similar to the second, a few hours of oxytocin, and then about 10 minutes of being fully dilated, and she came out. And I don't think I was a very good patient at all. I think that I didn't do anything that my doctor said with those second two. It was so fast, and that last 10 minutes hurt quite a bit. And so all I remember is keeping my eyes closed and not doing what they said, swearing, and then the baby came out, and I don't even know if I pushed it out or what happened, but it did come out. And so I know what it's like to be in your shoes, trying to listen to us to say when to push, don't push, and I didn't listen. You should try and listen, but I wasn't any good at it. And then that was the third, and I would say all of them had quite a nice recovery and postpartum period. But the one thing that I would really recommend is that how to get your baby to sleep and be nice to you is a really good thing to spend time on before you have your baby. So I had done some reading about how to get your baby to sleep. A book that I thought was really helpful was Happiest Baby on the Block. And maybe having a talk with your partner about what your strategies are going to be for getting the baby to sleep. A lot of people worry about their labor and delivery, and it's a very special experience and something you only do maybe one or a few times in your life. But having the baby be that little baby that's hard to get to sleep, that period lasts for months. And so I definitely encourage you to work on getting that part a bit straightened away before you have the baby. And then the other thing that I would recommend is if you're thinking to maybe have your babies without an epidural, which is what I ended up doing and using, like I said, a lot of the nitrous gas. But if you're thinking to maybe do that it would be a really great idea to do some preparation ahead of time for how you might get yourself through that. And we have some videos on different analgesia that you can have when you're in labor. But if you're thinking to maybe not have an epidural, especially with your first baby, to do some reading around how to keep your mind calm when you're feeling a fair bit of pain. And a book that I found really helpful was Hypnobirthing. It was recommended to me by one of my nursing colleagues, and I thought it was great, and I highlighted and I dog-eared and I read it with my partner, and then I would reread the highlights every time I was about to go into labor and be like, okay, get my head on straight, I'm gonna do this again. And so something, even if it's not that, just something to train your mind ahead of time. And then my final tip is probably to not have too much of a plan before you go in. To just sort of keep a loose plan about a few general things about how you'd like things to go, and other than that, just to take it as it comes and enjoy it as it comes, and ask us questions as we go along. And we always have time to discuss things as you go along, so you don't need everything sorted out before you come in. And my final pearl of wisdom was given to me by one of the old obstetricians, very wise, when I was a trainee, and he said, "Caitlin, we don't deliver the baby. The mom delivers the baby, and we just stand by to make sure everything goes okay. And I'm looking forward to standing by to make sure everything goes okay for you. Bye-bye.
Hi there, my name is Dr. Jane McGregor, and I'm one of the docs who work at Grow Health. I practice share with Dr. Power. She does about 8 or 9 months a year, and I do about 3 or 4 months a year with her. I have 2 daughters, Haley and Laura. My first, she came pretty much right on time. I tried to get sweeps, didn't work, and then went into labor the day after my due date. So good to try, but just if your sweeps aren't working, doesn't mean you can't go into labor. Super, normal delivery, and then had the colikiest baby ever for about 4 months. So worth having a talk about, what to do with a fussy baby and having a plan with your support people. I also tried all the different pain management things, including the laughing gas, morphine and Gravol, and an epidural. So go over to the Grow Health videos and check out the pain management in labor talk. I've tried them all. They're all different options. My second also came pretty much right on time, born on her due date, and she decided to be born sunny side up, facing the ceiling. So that was a whole different experience, but worked out fine, and has been an easygoing baby. So she's only about 9 months old now. So looking forward to meeting you all, and that's my story. Oh, here we go. This is Haley. Say hi, Haley. Say hi. And here's baby Laura.
Hi, my name is Dr. Kate Mojave. I'm one of the family doctors at Grow. I share practice with Dr. Lindsay Taylor. I have 3 kids. Ellie is 7, Leah is 5, and James is 2. And I had 3 really different birth experiences with each of them. My oldest was born by emergency cesarean section in Yellowknife a month early. And until about 15 minutes before she arrived, I had no idea she was coming that day. I was in the hospital to have a version where the obstetrician tries to turn baby from breech or bum down into head down position. She was not interested in that, and my water broke during the procedure. Her heart rate dropped very low, and it had to be a stat C-section. Totally not the birth experience I was hoping for or planning for. In fact, I was supposed to be on call at the hospital that night. I was actually supposed to fly home 2 weeks later at 38 weeks to have my baby in BC and go on maternity leave. So definitely a total shock at the time. My second birth was a little bit smoother. She was born in Calgary. She was full term. I decided to have a VBAC or vaginal birth after a cesarean, which is, it's really important to talk through that decision with your physician if that's something you're thinking about doing. Dr. Lee and Dr. Power also put together a lovely video to kind of help you go through the risks and benefits if that's something you're thinking about. So with her, I had a great epidural. I was really comfortable. My husband had made a wonderful playlist. So we basically listened to music and chatted all through the night while I labored. The only little blip was at the end. Her heart rate dropped down quite a bit as well. So the obstetrician had to rush in, the pediatrics team had to rush in, and she was kind of a quick vacuum delivery at the end just to get her out as urgently as possible to keep her safe. My third baby, I was born here in Victoria, and I was planning on a nice, easy birth again with a nice epidural. He had other plans. He came pretty fast and furious. My water broke on the way to the hospital, and by the time I got there, I was fully dilated, and it was too late for an epidural. So he was born an hour after I arrived. So I guess, my lessons from my birth are that there is no totally easy way to have a baby, and that it is nice to have birth plans and birth preferences, and your team at Grow will do everything we can to kind of make your birth experience what you want it to be and to respect your wishes. That being said, there are a lot of unknowns and a lot of things that can go sideways in labor. So I think it's also important to kind of accept some of the uncertainties that go along with labor, and kind of know that your team is here to really look out for you, to keep you and baby safe. And for me at the end, that was all that mattered at the end of my 3 births. The 3 best moments of my life are really the first times those 3 babies were put on my chest. And it really didn't matter how they came out, what it had for pain control, or whatever else had happened. So anyways, we are wishing you the best birth story, and it's always a privilege when we get to be involved with yours. Take care.
Hi, I'm Dr. Allianz. I'm one of the docs at Grow. I have a 2-year-old son, and I am working on a soon to be determined baby. I had a pretty great birth, I would say, with my son. Started around midnight and picked up pretty fast and furious quickly. Went into the hospital, and you know, I'd always said, well, we'll just see how it goes and how I feel. I was very happy to get an epidural. It was a bit of a delay getting that in, as my large 6'2" husband needed to kind of take a knee and be brought to the bathroom by the anesthesiologist, as he was feeling quite faint watching an epidural. But once it was in, I was a much happier camper, and ultimately had my little guy at 8 a.m. So 8 hours start to finish. And yeah, I was really happy with how it all sort of went. Hoping baby number 2 wants to be that easy. I would say, you know, in terms of advice, don't turn down any food offers or offers for help from friends or family. Don't make any appointments for yourself anytime before about 11 o'clock in the morning with a newborn, because it's really hard to get out of the house. And just be kind to yourself. It's not an easy time, and it's different for everyone. You're going to get lots of different advice from a lot of different places, and you know, together you guys will figure out what works for you. Good luck with it all.
Hi, I'm Dr. Alison Michelle. I've worked with Grow Health since we opened our doors in January 2015, and I've been delivering babies for about 20 years now. I enjoy meeting each and every one of you and working with you during your pregnancy, and I love sharing delivering babies with all of my colleagues here at Grow Health, and you can rest assured that if I'm not there at your delivery, they will provide you with wonderful supportive care. We're all telling our little birth stories, so I'll give you the synopsis of mine. I have 2 children. They are now 14 and 17. So my daughter, who is 17, came pretty easily and a bit early. I broke my water and went into labor, and my labor wasn't that long, only about 12 hours. It did feel pretty painful to me, and unfortunately 17 years ago or 18 years ago when she was born, we didn't have an anesthetist here in Victoria to deal with pregnant ladies in the middle of the night, so I didn't ever get an epidural for that labor. And it was certainly an achievement, but I don't know that I would recommend it. And I'm very happy now that women have better pain relief options than I had that night. Anyway, she's now a lovely young lady who's 17. And then 3 years later, I had another baby, this time a boy. He also came early, similar story, but just a shorter labor. I didn't have an epidural again with that labor, but actually that one was okay. I felt like I managed everything with just some other pain modalities. I had some fentanyl, used some gas, and out he came. And then I didn't have another baby, but I did have a dog, my baby dog, who you'll probably hear about because she is my 3rd baby. Anyway, I look forward to meeting all of you and working with all of you. Thanks for watching our videos.
Hi there, my name is Dr. Lorelei Johnson. I'm one of the doctors at Grow Health. I have 2 beautiful daughters. One is 3 and the other is turning 5 in a couple of months. For my first labor, I went a week overdue in my pregnancy. It was a very long week. My water broke before my labor started, and when my contractions did start, things were very intense quite quickly for me. My epidural was very helpful, and after many hours of hard work, my daughter was born. My second labor was very different. My water did not break beforehand the second time, and things were much slower, and that was very surprising for me because I thought it would be faster the second time around, but that was not the case for me. I got very frustrated by this and in fact tried to leave the hospital at one point in my labor, and the team had to sit me down and convince me to stay, which was the right decision because my baby was born just a couple of hours later. The delivery itself was a bit smoother the second time around. My big struggle after delivering my children was around breastfeeding. And so the thing I wanted to share was just letting everyone know that breastfeeding is not always a straightforward process. It often takes quite a bit of work to establish a good breastfeeding relationship, and there are lots of supports available to help you with that. So please do reach out if it's something that is important to you and something that you're having a hard time getting working right. And if it's not something that's working for you or not something that fits with your family, that's okay too. Fed is best. So all this said, I look forward to meeting some of you in the office and some of you at the hospital. And I wish you all very special journeys through your pregnancies and deliveries. We look forward to working with you.
Hey, it's Dr. Alicia Power here. I am one of the family docs at Grow Health, and I share practice with the lovely Dr. Jane McGregor. I work about 8 or 9 months a year, and she works about 3 or 4 months a year. You can hear her daughter screaming down below, pleasantly chit-chatting. I've got 2 kids, Evie and Wyatt. Wyatt is almost 8, and Evie is 6. Wyatt, my first, came late, and I learned through that process that apparently if you came late as a baby and you have a firstborn son, most likely they're going to be late. I was induced, and you can check out our video on induction and augmentation. Evie came as a bit of a surprise, her delivery. I ended up with an emergency cesarean section, and she spent 3 weeks in the neonatal intensive care unit. So from that, I learned all about being a parent in the NICU and having a delivery that was very much unexpected. The thing that I wish I had known about before my first was creating a sleep plan with my husband. But newborns sleep a lot, but they don't sleep for long chunks, and it's pretty hard to get them to sleep consistently at night. So if I had realized that before, my husband and I would have had a better plan right off the bat. So each of us got 3 or 4 hours of sleep consecutively a night. So chat with your friends, chat with your care provider about that if you want.
Hi, I'm Dr. Shana Johnston, and this is my baby, Maya.
And these are my babies, Laureline and Lumi.
Maya was born 12 years ago. I had a really nice normal pregnancy, and then the delivery was a bit challenging though. I got stuck at about 7 centimeters for about 4 hours, which was very tricky. But I did manage to get through things. I actually didn't have an epidural, which I'm not sure I recommend for if you do get stuck in labor. I think epidurals are probably a good idea, but I powered through, and Maya was born. And then the first few weeks were pretty normal. We got out and did a few things, and then when she was about 3 weeks old, things started to go downhill, and she started getting a lot more fussy, and I started having a lot more trouble coping. And then she started screaming most of the day, and so it got to the point that she was screaming for about 6 to 8 hours a day, and the only way I could calm her down was to bounce her on my exercise ball with her swaddled with a soother in her mouth, going shh, 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 for about 6 to 8 hours a day, which really took a toll on me. And I found that my mood just started to get worse and worse and worse, and I got more and more anxious. I stopped being able to sleep, and things got really, really tough for quite a while. My advice is, if you do get yourself into a situation where you're not coping like you think you should, ask for help. I called my mom, and she flew up from New Brunswick and helped us. I talked to my doctor, and she recommended that I start medication. I joined a support group for other moms with postpartum depression, and altogether it did make a big difference. It took a while took another month or so to get better, but then we started teaching Maya how to sleep, and by the time Maya was about 4 or 5 months old, I had this beautiful girl who would sleep through the night, and and then by then I was just really enjoying motherhood. And so my advice to you is, if you're having a hard time, ask for help. It's becoming a mom is probably the hardest thing I ever did, but it's also the most wonderful thing I ever did. So I wish you all the best, and I hope you have nice, smooth, normal labors and journeys into motherhood. And if it isn't as smooth as you'd like, don't forget to ask for help. All the best.
Hi there, I'm Dr. Julianne Reamer, and also part of the Grow Health team. And wanted to thank you for trusting us to share in this time of your parenting journey that you're spending with Grow Health team. That's a real privilege to be able to share this time with you in your pregnancy and your labor and your birth, and beyond that as well. So thank you for entrusting us with this special part that you have. My husband and I are parents as well. We have 3 wonderful kids, and one of the pieces that I would share about sort of the labor and birth process is a statement that you may have heard lots of friends or family or nurses or doctors say in the past, and that is that every pregnancy, every delivery is so different, and I can vouch for that for sure. We have 3 kids. The first was a quick 4-hour labor that was no time for an epidural. The second came rocketing through even faster, and the third needed an induction and was an all-night labor and into the next day. Needed an epidural for that one, and got the epidural, I should say. And and we ended up with 3 very different kids. One with each color hair. We got a blondie, a brunette, and a redhead, and such different personalities as well. So it's it's pretty neat to see who each person is right from the start. Our team is made up of nurses and learners and physicians, as you have met throughout the rest of the videos. And we just all are very passionate about what we do, and we do it because we love it. And we can't wait to share this journey with you. Look forward to meeting you. Talk to you later.
Hello, I am Dr. Sara Lee. I am one of the maternity docs at Grow Health. And I too just want to say welcome to our team, and thank you so very much for choosing us to help you through this incredible journey into motherhood, parenthood, and all that comes along with it. I am a mama as well. I have 3 boys, and I'm going to share a little bit about my birth stories and a little bit about what I've learned and what I wish I had known. So Henry, my first, sorry, you'll hear them in the background too, real life. Henry came on his due date after about 2 days of prodromal labor. So prodromal labor is just contractions on and off that aren't really going anywhere, and aren't really causing your cervix to change. So that was pretty tiring. So ultimately I ended up going into the hospital, and I was checked by my maternity doctor, found to be about 3 centimeters dilated. She did a cervical sweep and stretch, which definitely kicked me into labor. They gave me some pain meds to go home and try and sleep. I did not sleep. I writhed around in my bed. I had a hot bath. And that was probably 8 p.m. at night. We went back in around 3 a.m. I got an epidural, which was life-saving. I slept my way to fully dilated, got a little oxytocin to help because my contractions slowed down. And then I started to push. And it took me 3 hours to push my darling Henry out. But he came on his own. And he is the sweetest boy. And I'm so thrilled. And I would do it again. Because I did. And then my second, Johan, he came a week early. And getting into labor was much quicker. I woke up in the morning and I was 39 weeks. And I said to my husband, I don't think you should go to work today. And I texted my parents who were on the mainland, and I said, I think you should come today. We went to the hospital around 10 a.m. After our nanny got here to look after Henry. And this one was a little more complicated. When I got to the hospital, I was 5 centimeters dilated, but they put me on the monitor because I wanted another epidural, because my labors are just super painful, and it's how I labor, is with the epidural. And his heart rate was high and flat. So I got my epidural, they broke my water, and there's meconium, which means baby's pooped on the inside. Hey, thank you. You're a hero. My husband just brought me coffee. And so they watched me really closely. Ultimately, I needed to have a forceps delivery. In a few minutes, buddy. So that was, okay, can you put the shovel down and go ask him, please? And that was fine, because I had an epidural, and I knew it was the right thing because he needed to be delivered. And he came out screaming, OP, so facing up, which was not ideal, but happens. And he is a unique bird to this day. And after that, they were 14 months apart, guys. So that means that I got pregnant 4 months postpartum. So I will talk to you all if you get the pleasure of talking to me about postpartum contraception, because I feel very strongly about that. So we waited a little bit and then decided our family was still not complete. So we had our third. We had Will.
And Will, I did not want to go overdue with Will because I didn't have to go overdue with my other two, but third babes can be pretty unpredictable at times. So I went for, I think, twice weekly sweeps, membrane sweeps with my doctor after 38 weeks. And I did go into labor on my own with Will. But again, I had prodromal labor. So I just had a day of contractions on and off. And I'll help you in like 1 minute, okay, sweetheart? And I got to the hospital after a day of prodromal labor to get checked out. And I think I was about 3 centimeters dilated.
Mom, have you seen the weight of this?
I haven't, sweetheart.
Oh no.
So, you know, 3 centimeters dilated is kind of the borderline of being in active labor, especially as a multip, so someone who's given birth before. So I walked the stairs up and down and up and down and up and down, trying to get myself into active labor. I think I did the stairs at the hospital about 7 times, and there's 7 flights of stairs. And I came back down to get checked again, and I was still 3 centimeters dilated, and I was feeling pretty just frustrated. You know, I just either wanted to go home and sleep or get into labor. And so I had a chat with my doctor, and she said, well, do you want me to break your water? And I said, I don't know. And my water broke while she was examining me. So there we go. So I got an epidural, I labored, got to fully dilated, and pushed about in 20 minutes. And he has been an easy baby ever since. So we've all been there. We've been in your shoes, and we've had to make those decisions, and we've felt that uncertainty. And like all my other colleagues have said, we all practice very similarly. We believe in women-centered care. We believe that the choices are yours to make, and we're here to guide you and inform you and help you make those decisions. And, you know, I think the one thing that I wish I had known, especially before my, when I had Henry, was that it's okay to ask for help. It's important to ask for help. It takes a village to raise a baby and to build a community.
Hello there, my name is Dr. Lindsay Taylor, and I'm another one of the doctors at Grow. I practice share with Sara Lee and Kate Mahaffey. I have 4 babies I have 4 children who used to be babies, who I still think of as my babies. My firstborn, she is a girl, she's 7. She was born in Halifax, and she came about a week and a half early. And when I look back now, my labor sort of started, my early labor started while I was in my office in clinic, and sort of picked up through the day. And I was very nervous, obviously, about going into labor, which is totally normal. I had a membrane sweep, which I think really helps get things going. I'm a believer on my own experience. I'm a believer on the membrane sweeps. I had in my mind I didn't want to have an epidural to have my baby. So partly, I guess, partly just because I was scared of having an epidural, but also I just kind of wanted to see what it was like to have a baby. So I coped with the pain in labor with a variety of ways. I think I got a lot of mileage out of the bath. I think I spent hours in the bath. And I also did a lot of like moving around, which I think is really good for a lot of people, like a lot of sort of pacing and squatting and dancing and hips and just kind of movement, and a lot of weird primal animal sounds and probably some cuss words, I think. But it went well. Pushed her out. She came out. She was huge. She was way bigger than I would have thought. She's super cute. And despite the pain and misery of labor, it's definitely one of the best days of my life that I can remember. Then my second born, he's a boy, he's 5. He got born in Squamish because we'd moved, and I had a midwife follow my pregnancy for that pregnancy, and she didn't do much in the labor. She just kind of stood there and let me do my thing. And the labor was much the same as the first, just a bit quicker. My husband caught him, which was fun. So that was that. And then my third pregnancy, I got surprised with twins. So that was a shock, and I was initially very unhappy about that, but now I would never have it any other way. I think twins is the coolest, and I'm so lucky I've had that experience. I had a very fortunately healthy pregnancy, but it was tough. It was physically quite tough, and I learned a lot that helps me now as a doctor. Like, I learned what my patients mean when they say they feel really done with being pregnant and they're really uncomfortable in the 3rd trimester. Like, I get that now. So I had to have an induction for that, because you often have to with twins. I had to go to the city. I was very nervous, like very nervous to have an induction. It's really weird to wake up and like drive to the hospital knowing that you're gonna have a baby. And I was supposed to, my doctor asked me to have an epidural, so I did that. So what happened was they just broke my water, and then I got into good labor and I got the epidural, which I can only describe as magical. It was incredible that they took all the labor pain away. And it was coming, like, I will tell you, as a sort of needle phobe person who gets worked up about my flu shot, it was easy peasy. It was not a big deal to get an epidural. It was fine. So then I just pushed the first baby out without feeling anything at all. And she put him up on my chest. It's 2 boys. She put him up on my chest, and I like sort of held the baby while the obstetrician yanked the other baby out by his feet, which was a very bizarre experience, but that's what it was. And it was awesome too. Very different, but like totally awesome in its own way. Yeah, so I love reflecting back on my birth experiences, and I love being part of my patients' birth experiences. It's such a privilege. If I had to give any sort of advice or words of wisdom, I think what I would say is just keep your eye on the prize. Labor can go many ways, and just remember, the goal at the end is a nice healthy baby and a healthy mama, and that's usually what happens. So yeah, whichever way it goes, remember that. And whichever way it goes, I think it asks everything of you. Yeah, whether it's vaginal or C-section or lots of pain or not much pain, becoming a mother asks everything that you have, and it's very powerful. So I look forward to being involved in some of you with your labors and deliveries. I love welcoming your babies to the world, and I love watching people become parents. It's amazing. Never gets old. So thank you for choosing Grow and for trusting us to look after you. Yeah, look forward to meeting you.